Another common ideology for anxiety, or I don't know if ideology is the right word, but another source for it is the need to be in control. I need to
Mm.
have everything done exactly the way I like it at exactly the time I like.
Yeah.
Forces a lot of professional women to push away help. And
Mm.
so again, you're left doing everything to perfection all by yourself. So relinquishing control, especially when it doesn't count, doesn't really matter how someone puts on a diaper. As long as the diaper is put on, and this is just a very baby related um,
Yeah.
example, but if as long as the diaper is on the baby, it shouldn't really matter. But we perfectionists, professional women like it done a certain way, and we obsess about how things are done. So allowing ourselves to become mindful of where we can yield control
Mm.
so that we can have rest and be
Yeah.
less worried, I would say would be two very broad approaches to non-pharmacological interventions for anxiety. In
Mm.
terms of real things we can do that
Mm.
are non-pharmacological, there are relaxation techniques. Is that kind of what you're thinking about, Dr. Brown?
Absolutely. Yeah.
So my favorite and my personal favorite, and one I use a lot, is deep breathing,
Mm.
which is a process of becoming mindful of your breath, how you take it in, slowing it down. I like this a lot because it physiologically, when we do that, slows down our heart rate. And
Mhm.
I've done this while hooked up to machine, so I know that when you take deep breaths very slowly, not hyperventilating, the deep breathing exercises can help us manage an anxious situation in the moment. You can slow
Mm.
your body down, regulate your physical self in the moment, and that's some
Mm.
way to regulate in the moment, control anxiety. Other forms could be body scan, where you're just being
Mm.
mindful of parts of your body a little bit at a time, but watching it. That can help us feel calm in the moment. And I think I've
Mm.
heard this also used in a sleep setting as well, when you're trying to go to sleep. But
Yeah.
it's a way of, calming, regulating your body. Guided
Mm.
imagery is another, as well as progressive muscle relaxation. I like that a lot as well. That can really put you to sleep. Progressive muscle relaxation, and it can
Yeah.
be very helpful in anxiety situations. There are also other kinds of counting techniques that people can
Mm.
Google. Lots of YouTube videos about this, by the way, for
Mm.
anyone listening who wants to kind of venture or explore out into these things. So those are some practices. I would say that these practices don't work well if you haven't practiced them. When
Mhm.
I tell people to do deep breathing, they try it like when they already are anxious or in a panic, and
Yeah.
of course it doesn't work because they're not practiced at doing it. So they end
Mm.
up hyperventilating and making the problem worse. So
Mm.
I say that if you plan to choose any of these methods, to look it up. Um, there are lots of YouTube training videos on them, and you can practice, make it a daily practice. That way, if you're practiced at doing something, if you have to call it up, when you do it, it can feel natural. And it's not like you're trying to learn how to do it while you're panicking and you're anxious.
Mm. Mm.